Gastritis? It's one of those medical terms you've probably heard thrown around. But what is it really? Well, today we're going to get into it. We're going to explore this hidden fire in the stomach that, believe it or not, affects millions of people. You know that feeling, right? That nagging, burning, sometimes aching pain right in your upper stomach. A lot of us just brush it off as, oh, I ate something weird. But what is actually going on inside our stomach lining when that feeling hits? Well, a lot of the time, the culprit is gastritis, and all that fancy word means is inflammation of the stomach's protective lining. So think of this lining, the gastric mucosa, as a shield. It protects your stomach from its own powerful acid. Gastritis is what happens when that shield gets breached, irritated, and inflamed. Okay, but here's where it gets really important. Gastritis isn't just one thing. It actually comes in two totally different flavors. You've got acute gastritis, which is like a sudden kitchen fire, intense and obvious. And then you have chronic gastritis, which is much more like a slow burn, smoldering quietly in the background. All right, let's talk about that first one, the sudden attack, the kitchen fire. This is the kind that flares up out of nowhere, it feels awful, and it absolutely gets your attention right away. And you look at this list of triggers, and it's kind of wild how varied they are. It can be something super common, like taking everyday pain pills, aspirin or ibuprofen. Or it could be an infection from that famous H. pylori bacteria. It can even be triggered by extreme physical stress on your body, like after a major accident or surgery. And when this kitchen fire starts, oh, your body lets you know. The signs are usually sharp and clear. You get this distinct pain right below your ribs, and it's often paired with nausea, maybe even vomiting. It's basically your body's fire alarm screaming that something's wrong. The good news is, the game plan for putting out this fire is pretty straightforward. Doctors have a three-step approach. First, you gotta reduce the acid with medications like PPIs. Second, you add a protective layer over that damaged lining. And third, the most important step, you find and get rid of whatever started the fire in the first place. And here's the real key takeaway. While it feels absolutely terrible when it's happening, the outlook for acute gastritis is usually really, really good. Once you remove that trigger, the stomach lining is amazing at healing itself. The kitchen fire gets put out and things go back to normal. But now, we have to shift gears to a completely different animal, chronic gastritis. This isn't a sudden fire. This is the slow burn, the kind that can quietly weaken the very foundation of your stomach over months, years, sometimes even decades, without you even knowing it. So unlike the acute version, the chronic kind gets broken down into two main camps. You've got the non-infectious causes, like autoimmune conditions, where your own body is the attacker, and then you have the infectious causes, a category that is just completely dominated by that same bug we saw earlier, H. pylori. And this is exactly what we mean by a slow burn. An untreated H. pylori infection just smolders quietly. That constant low-grade inflammation year after year slowly destroys the stomach's glands. Over time, the cells actually start to change their form, creating a dangerous situation that significantly raises the risk for stomach cancer down the road. The other major type of slow burn is autoimmune gastritis. And this is fascinating, in a way. Your body's own immune system gets confused and starts attacking the cells in your stomach. This not only causes inflammation, but also stops you from absorbing vitamin B12, which can lead to a whole host of other problems like pernicious anemia. Okay, so you've got the kitchen fire and you've got the slow burn, two totally different beasts. So how on earth do doctors figure out which one is going on? And what do they do about it? Well, the gold standard is an endoscopy, where they actually put a tiny camera down to look at the stomach lining. But just looking isn't enough. To get the full picture, they use this very specific 5-point biopsy protocol. By taking tiny samples from different parts of the stomach, they can create a map to understand exactly what kind of damage is there and how widespread it is. And for those chronic cases, those little biopsy samples are put through special staging systems. You might hear doctors mention acronyms like OLGA or OLIGIM. This isn't just about confirming a diagnosis, it's about predicting the future. It's like getting a risk assessment for your stomach, helping doctors figure out the long-term risk of cancer, which is absolutely critical. And that leads to completely different treatment goals. For the kitchen fire, it's all about putting out the flames and getting immediate relief. Simple. But for the slow burn, the focus totally shifts. It becomes about long-term strategy, getting rid of H. pylori for good, managing other health issues that pop up, and, so important, regular screening to catch any signs of cancer early. So let's bring all of this home after digging into the fire and the slow burn. What are the big takeaways? Why does knowing the difference between these two conditions actually matter so much? It really all comes down to this. Acute gastritis is fast, loud, and painful. Its risks are immediate, but its prognosis is fantastic. Chronic, on the other hand, it's slow, it's quiet, and the symptoms can be so vague you might not even notice them. But the long-term risks, ulcers, stomach atrophy, and cancer, are serious. It's the one that requires lifelong attention. So, in the end, understanding the difference between a temporary kitchen fire and a dangerous, quiet, slow burn is everything. It makes you ask a pretty important question the next time you feel that discomfort. Is this just a passing problem, or is my stomach trying to send me a much more important message that I really need to listen to?